Hello, a very good evening, everyone. Welcome to today's webinar. So this is another one of our webinars, in our information series where we speak about different topics, which is important when it comes to chronic health issues that most people are struggling with today. And today we will be talking about autoimmunity and the leaky gut connection. So those of you who have not followed our series on Instagram and Facebook, where we had different posts on various things around autoimmunity and leaky gut, so do check that out on our Instagram and Facebook. So, all right. We already received a lot of questions from many of you. We will be taking the questions towards the end. So before we come to the questions, I want to take you through some of the basic concept about autoimmunity and leaky gut. I'm Dr. Ruhi Agarwala, co-founder of Functional Medicine Clinic, and I have Dr. Ashwani as well. He will jump in the Q&A session. He doesn't have a great throat today, so we will have him rest and jump in the Q&A session. All right. Okay. So let's understand what really autoimmunity is. Okay. Now, it's basically your immune system which has started affecting your own body cells. Now, in a healthy individual, an immune system is pretty much resilient. It pretty much knows its role and it will not attack your organs, right? But what happens in a dysregulated immune system, which means an immune system is kind of, it's off track. It does not know, it's not able to differentiate what is whom it should protect and whom it should fight. So it's just gone haywire and keeps doing all sorts of random things. And that's basically is autoimmunity, where the immune system starts attacking the healthy tissue of the body. And this can be any part of the body. It can be your thyroid, it can be your skin, it can be joints, it can be your eyes, any part of the body it can be. And interesting thing is, once autoimmunity starts in the body, it may start with one organ. Let's say it starts with Hashimoto, where it's affecting the thyroid. But it will not restrict itself to thyroid, because it's a process, right? So if you're not doing anything about stopping autoimmunity, it will keep involving other organs also, because it has just got access to the entire body. And so you can basically imagine, right? Your immune system is, kind of fighting too many triggers. And these triggers are infections, toxins, allergens, stress, so many things, right? And all of these are constantly triggering the immune system. In a healthy individual, this immune system knows how to behave. Here, it has gone crazy. Okay. Now, why really does it happen? So the conventional thought about autoimmunity is, and I'm sure most of you would have heard this when you had first time you got to know about the diagnosis, that it's genetic. Now, and you would be wondering that you don't have anybody in your family, having any kind of autoimmune condition. You just keep wondering, where did it ever come from? So actually, what is just known, as genetic, it's not really completely genetic. Okay. So the conventional thought of autoimmunity being incurable genetic disease where you have to be on pills for life, it's kind of not true, because you were not born with it. You were pretty healthy, and probably at an age of 30, 35 years, you got a diagnosis. Some may get early, some may get late, right? But you have acquired it during your life. Now, if you have acquired it during life, definitely there were certain choices that you made. These may be conscious or unconscious choices that you made to your body, which led to the development of autoimmunity. So it is definitely acquired. So the functional medicine approach explains autoimmunity as the body reacting to various environmental factors. Now, these environmental factors can be chronic stress. You are not moving your body to a parasympathetic mode, which is basically meant for regeneration and repair. You're constantly stressed. Your body is in the sympathetic mode. So it's not able to come out of the cycle of fight and fear. It's constantly in that fighting situation. Whereas for the body to heal, it requires the state of parasympathetic dominance where it can relax, it can repair itself. Viral infections can trigger. So many people developed autoimmunity post COVID infection. Why? Because viral infections can trigger autoimmunity. Bacterial infections can cause, various medications can trigger autoimmunity. Fungal infections are one major cause, yeast, candida overgrowth. Fluctuation of the hormones, you're nutrient deficient, which is the basic. So your immune system needs a lot of nutrition. And if your body is chronically deficient in various nutrients, it can contribute to a dysregulated immune system. Toxins, there's so many toxins in the environment today. Heavy metals, all these can trigger the immune system to behave in a way which is not expected. Now, some people can be genetically susceptible, which means they may inherit certain genes which make them prone to certain conditions. However, this does not mean that they will develop an autoimmune condition for sure. It's just making them genetically susceptible. If you give these people a healthy environment, these genes can shut off. On the other hand, if you give them a bad environment, you give them exposure to a lot of toxins, a lot of stress, infections, then these genes turn on and they contribute to disease. So genes may have a role, but not everybody who has autoimmunity is genetically susceptible. So the science of epigenetics plays a very important role in in the autoimmune process in an individual. So if you're just settled with the fact that you were told that your autoimmune condition is genetic, it's time to rethink. Just because someone told you genetic and you cannot do anything about it, it's not the end of the world. So you'll have to think that what really has contributed to autoimmunity. So in short, genes can load the gun. It's the environment which pulls the trigger. It's a very common phrase, and it very much holds true here. So there are various causes of autoimmunity. A poor mitochondrial health. Mitochondria is the energy house of the cell, and infections, heavy metals, nutrient deficiencies, all these will disrupt the mitochondrial function. And if your mitochondrial health is poor, the various biochemical processes are disrupted. The hormonal balance is disrupted. You can say almost every physiological process in the body gets disrupted if your mitochondrial health is poor. Leaky gut, one major contributing factor to autoimmunity. We'll talk in detail about that. Poor gut health, where there is an imbalance between the good and the bad microbiota. Heavy metals, genetics may play a role. Your nutrient deficiencies, chronic stress, all these are contributing to autoimmunity. So if you have not looked into any of these factors and you're just kind of suppressing your symptoms, you are losing out on the possibility of resolving your autoimmunity. Now, many times we get a question, is Hashimoto treatable? Is rheumatoid treatable? Is psoriasis treatable? So these are just different names of an autoimmune condition based on where the autoimmunity attack is happening, right? If it's a thyroid, it will be called the Hashimoto. If it's your skin, it may be lupus. If it's your gut, it's called the celiac disease. Joints, rheumatoid. So it's just a different name of the same process that is going on in the body. So the baseline is autoimmunity can be treated. Doesn't matter what autoimmune condition it is. It has, it does not matter at all what's the name of the autoimmune condition. What we really need to look at the root causes of autoimmunity. Now, let's talk about leaky gut and what's a healthy gut. So if you see this side, these are the lining of the gut. Okay, the cells are very tight. There is no there's just enough space between these cells to for the nutrition to be absorbed and the waste to be thrown out. And that is how it is in a healthy individual. Now, based on what choices we are giving to a body, right? And these are there, and these can be various factors. It can be low levels of vitamin D, which is a very important nutrient for the gut lining. Uh, you're exposed to a lot of gut infections, right? Yeah, let's say you're taking a lot of refined food, a lot of processed food. So this will disrupt the gut lining. This will increase the gap between those junctions and basically promote a lot of unwanted pathogenic growth. Toxins, chemicals, you're exposed to a lot of toxins, chemicals, plastic, um, uh, microplastics, glycophosphates. You're stressed. You're taking a lot of medications, be it NSAIDs, SSRI, hormone pills, etc. You've been on courses of antibiotics. That itself can contribute to a leaky gut. Gluten, which is basically it's an inflammatory food, so that disrupts the gut lining. And of course, refined and highly processed food. So all these can disrupt this gap between the tight junctions. So what happens now if the tight junctions gap is disrupted? The toxins will get access to the bloodstream. So something, those junctions did not allow the toxins to move into the bloodstream. Now they've got free access, right? So all the waste in the body will get access to the bloodstream. All the um, all the toxins will get access. The microbiome, the microbes, their LPS, etc. All of these get access to the bloodstream, and now with the blood, it's going to the entire body. So, and the immune system is trying to protect you. It will react to these things, okay, because its work is to protect you. So now you can imagine it's become a war zone. It is constantly fighting so many triggers which have got access to the bloodstream. And in this process of fight, it unknowingly ends up damaging the body tissues. Because here now these things have got access to various cells, tissue, and it's the immune system has basically called for an attack in the entire body. So in this entire process, poor body cells get attacked. Now, what do the leaky gut symptoms can be like? One will think, okay, a leaky gut may look like bloating, it may look like indigestion, something basically related to gut issues, but that's not true. What happens in the gut does not just remain in the gut. It can appear as headache. Someone has been having chronic migraines, headaches without any trigger. It can be a sign of leaky gut. You have brain fog, you're not able to focus. You just feel that something is in front of your brain. That's a very typical sign of a leaky gut. You have a poor skin condition, a lot of eczema, breakout acne. You feel tired all the time. You have a lot of mood swings. You may be depressed. You're not able to lose weight. You have a lot of post-nasal drip, so which basically means you have a constant um, need of clearing your throat, or your sinuses are all congested. That's also can be a sign of a leaky gut. Your joints are aching. You may have tight muscles. You feel tightness in your arm muscles, leg muscles. Um, you feel like a constant pain in your body, which you're not able to explain. You may have canker sores. You may feel shortness of breath. And of course, there may be GI related symptoms also, where you have stomach pain, nausea, GERD, etc. So now most of these symptoms are not gut related. and often go overlooked. But it's very important that when someone is experiencing these symptoms, leaky gut is looked into. That person has a leaky gut and it should be fixed. So basically, our body is a reflection of our gut to a great extent. And as I said, what happens in the gut does not just remain in the gut. So it shows up on your skin as acne, rosacea, eczema, psoriasis. It shows up as asthma, allergies, food sensitivities. Your liver may be affected. Your liver may be sluggish. You may be diagnosed with a fatty liver. Your hormones may be out of balance. You may have estrogen dominance. You may have hypothyroidism. You may have an adrenal fatigue because of a leaky gut and poor gut health. Your oral health may be bad. You may have poor heart function. And of course, the gut and the brain axis is very important. So you may be struggling with fatigue, brain fog, anxiety, cognitive decline. So in a nutshell, again, a leaky gut can contribute to symptoms anywhere in the body. Now, just imagine if you are just taking immunosuppressants for your rheumatoid arthritis or any autoimmune condition, you are not doing anything about what really is contributing to autoimmunity. You're not doing anything about the leaky gut. So again, so what happens in the gut does not stay in the gut. In fact, it is also related to autism, dementia, OCD symptoms. Now, just a snapshot of what leaky diet should not be like. It should not be rich in processed food. It should not have gluten. Avoid processed meat. Um, avoid dairy, alcohol, high sugar content, fried food, sugar food. What you should actually be taking is vegetables and non-sweet fruits. So do not take a lot of sweet fruits like mangoes, banana, etc. We also had a question where one mother had asked that, she can see worsening of a child's gut health when she gives her mangoes and banana, right? Because it is a source of sugar and it is aggravating the child's gut health issues. You can take meat, poultry, eggs, again, um, not in the early stages, but maybe later once the gut has started healing. You can take fish and seafood if you're sure of the source. Um, Prebiotic plants are good, such as asparagus, cabbage, broccoli, um, sweet potato. All these are good. Beans and legumes are good. Uh, you should go for gluten-free grains only. Soaked nuts and seeds are good for your gut. Herbs and spices are good. Opt for healthy fat. And here I'm talking about fat from avocado, fat from olive oil, um, coconut oil, ghee, especially Vilona ghee. Go for those. Um, Fermented or cultured food can be taken, but not in the initial stages of gut healing, but only in the later stages when you've cleared the infections. There's a lot of buzz around probiotics, kefir, kombucha, umbli, but it's not a good idea to take these things when you are trying to repair a leaky gut. Take this towards the end when you have cleared the infections. Go for herbal drinks, avoid the dairy drinks. So that's a basic of a leaky gut diet. Now let's understand the basic protocol to heal the gut. The first thing is you have to reset. And here we are talking about resetting the diet. Not just the diet, we have to reset our lifestyle and also the mindset. So there has to be a sync between what you're actually doing, what you're eating, what you are, the changes you're making in your lifestyle, and your mind, whether it is accepting that, you're making all these and you want to get better. So that reset is very important. Remove anything that is a trigger to your body. So remove all the inflammatory food, remove whatever you can identify as a trigger. Do not wait for a test to confirm if you have food allergy to this particular food or not. You know your body is not reacting well to that, please avoid it. Now, when you have a leaky gut, your body has lost, a lot of um, capability of producing enough enzymes. The liver needs support, the gallbladder needs support, the stomach needs support as well. So provide your body that support with the help of digestive enzymes, bile salts, stomach acid. um, Support your liver, because this will help in the repair process. Work on sealing those leakage in the gut, and here it will require a lot of protein. It will require things like aloe vera, um, and various other things. Various herbs would be required. Now, when you have a leaky gut, a poor gut health, you may not be able to digest protein. So it's not a good idea to take a lot of beans, legumes, meat as a source of protein. You need protein in a form which is easily digested. So here you have to opt for the protein form, which is hydrolyzed. So protein will help in repairing those leakage. It will also help the stomach to rest. You should choose the right strains of pre probiotics, postbiotics. And here, do not take a widely fermented food like curd or kombucha, kefir, etc., sauerkraut. Please avoid that. Go for specific strains of probiotics which you know, because this is very important. We've seen worsening of a lot of cases where they just started taking a lot of curd, they started taking a lot of kombucha, kefir. These are widely fermented, and it can add to the histamine load to the body. Now, as you start healing, right, do you want to introduce the food that you have earlier removed? Well, give your body at least 6 to 9 months for healing. Do not interfere in this process by introducing gluten again, dairy again, sugar again, because again, gluten itself has a half-life of 45 days. So you don't want that healing process to be interrupted just by one episode of, where you'll say, I just had half a biscuit, but then that is going to stay in your body for quite some time. So give your body that time of 6 to 9 months to completely recover. After that, once your symptoms have improved enough, that's when you can try introducing food. And again, if you don't feel the need for it, there is no need to introduce these food. But if at all you want to, you can try and see if your body is doing better with that. You may have to take support of certain digestive enzymes, which is fine. And you should continue to retain this gut lining integrity. And so you have to continue to be on a clean diet. Once in a while, here and there, you have something with the support of digestive enzymes, probiotics, that's okay. But do not go back to a completely bad lifestyle again. So some of the things that can be very useful in healing the gut is L-glutamine. But of course, you should take it in caution with, especially in people who have fibromyalgia, etc., where it can exacerbate certain symptoms. Make sure you're taking the basic vitamins like vitamin D, A, zinc, B complex, omega-3, protein. These are the basics. Mucilaginous herbs like aloe vera, slippery elm, marshmallow, DGL, zinc, carnosine, all these will be useful in the process of repairing the gut. Certain food which will help you in healing will be okra or lady's finger, chia seeds, ground flax seeds, artichokes, legumes, bone broth, collagen. All these will be useful. So try incorporating these foods while you're working on healing the gut. So that was about the information we wanted to share with you today. So let's open up for questions. All right. So I will start with some of the questions that we already have. Okay. So how is HCQs related to the treatment of APLA? Now, commonly we see HCQs is not just related, not just given with people who are on the treatment for APLA, but also for any autoimmune condition. It's a very common prescription. And so, Dr. Ashwini, you want to answer that?
Right. I think the role of this is as an immune modulator. Now, it does not solve the problem in a way, but it is used to sort of suppress the immune system possibly or modulate the immune system uh, till we sort of fix the problem. Now, if we don't fix the problem, then it becomes a lifelong thing. And then even the disease is progressing, we're still doing it. So it does not really solve the problem in a way.
Right. And then there's another question about Azuran. Why is Azuran prescribed in SLE?
Okay. So, so it is conventionally, we think that immune system problems are permanent in the body. There's no way we can fix it. Only way to tackle autoimmune problems is to suppress the immune system. Okay. So immune suppressants are used, steroids are used, and immune modulators are used. But there is no attempt or there's no understanding so far in the large system where we are trying to eliminate the reasons or triggers of autoimmunity. That is where, when you don't remove it, you keep feeding and fueling the fire, then you have to suppress the immune system. There's no other way left with that.
Right. So let's jump to the most commonly asked question. Um, and this is for any kind of autoimmune conditions. We will not go for a specific autoimmune condition. How can we treat Hashimoto or rheumatoid arthritis or psoriasis or Sjogren's syndrome or lupus, be it any autoimmune condition? What will be the process to treat any autoimmune condition?
Okay. So there's only one way to remove the possible triggers of the problem. One of the major problem of the autoimmunity rise is the poor lifestyle. We hardly get enough sunlight. We are always under artificial lights. Now, when we don't get enough sunlight or even after sunset, we keep ourselves under artificial lights, our body is confused, our circadian rhythms are confused. Daytime body will metabolize, night is when body is repairing. Now let's say I don't expose my body to the darkness as the sun sets, my body does not repair, then I keep running on faulty cells. Now faulty cells will lead to a autoimmune process because body want to get rid of those faulty cells, but unfortunately we are not replacing them with the healthier cells. That's a major problem. Second is diet itself. If we're eating diet which we humans should not be consuming, for example, today a lot of the food is hybrid in nature, where protein is very very new to the immune system, and immune system is reacting to these new hybrid proteins in the food, or it is coming with a lot of pesticides, then it triggers an autoimmune reaction. Another one that we discuss is a leaky gut. Our gut is designed to digest the food, take the nutrition, and throw away the waste. But if the waste is not getting thrown away, rather it is getting into a system, it reacts immune reaction. Then this accumulation of toxins in the body. So these toxins can get stored anywhere. They will get stored in the cells only, right? So when any toxin, for example, mercury lead is stored in some part of the body, immune system want to get rid of it. Then also immune reaction can happen. Then, of course, nutritional deficiencies. If body is low on basic nutrients, which are required for our structural needs, then also we don't replace our old cells with new cells. We keep running on faulty cells, and immune system think it's a threat and it wants to get rid of them. So we have to change the lifestyle, we have to change the diet, we have to clean out the leaky gut, we have to clean out those infections. We have to remove the toxins from the body and nourish the body. then most of those autoimmune issues can be taken care.
So yes, so these are the various things that we need to work on. And the process would be like get a detailed investigation done where we can check for all the heavy metals, check for the nutrient markers, the inflammation in the body, the organ function, the gut health. We can check for leaky gut. We can check for mitochondrial health, etc. Get these detailed investigations done. And then we take a whole body sign and symptoms so that we understand the symptoms right from the head to toe and not just the gut symptoms. And then we correlate these biomarkers with the sign and symptoms to understand why your markers are high, why your symptoms are this and that. Based on that, a root cause analysis is done to come and design a personalized treatment plan where we focus on the diet, we focus on every possible lifestyle change that you can make to make the environment conducive for your healing. And of course, a targeted supplement plan to address the deficiencies, to address um, the infections in the body, the heavy metals, the liver support, etc. So Monica is saying I have ARIA and whenever I take curd, it flares up joint pain. So that's very common, Monica, and we spoke about this when I explained. Yeah, fermented food can flare up your autoimmunity symptoms.
So see, the gut already has an overload of the microbes. And when you take a fermented food, seemingly to be a healthy food otherwise, but you feed yourself with a lot of live microbes, which lead to a lot of histamine release and inflammation goes up and you can have pains, right? So if you initially when you're treating the problem, you don't want to take too many live strains of microbes. Now, also another important thing you have to understand, how do you make curd? You take milk, you put some culture into it and you let it ferment for 12 hours, 16 hours. You don't even know what you're fermenting. It is curdling. The milk is curdling to curd, but you don't know which microbes are there. There could be a lot of unhealthy microbes. There's no control that you have on that you are growing these microbes. And depending on the temperature, depending on where you stay, there can be some level of fungus is also growing, which could be very, very potentially dangerous. So when you are with an autoimmune problem, you don't want to take life strains. We have learned these hard lessons over a period of our practice. We had made the mistakes initially. We thought every fermented thing is good, but no.
Right. Um, so can my alopecia transfer to my daughter? So Anup, now again we spoke about genetics. How can genetics play a role? Okay, you can transfer bad genes to your daughter, but then what kind of environment you can give to your daughter, it's completely in your hand, right? And a very simple example, when a mother's body is not prepared for a pregnancy, when a mother has a lot of toxins in the body, infections, nutrient deficiencies, of course, all these will be passed on to the child, right? During the pregnancy, and that's why we see a lot of cases of juvenile autoimmune condition, right? A lot of cases of autism, and that is because all these toxins have passed on from the mother's body to the child, right? So it's definitely the body has to be prepared for a healthy pregnancy.
I think one very important thing to note here, child would get the microbiome from the mother. Now, alopecia is an autoimmune problem primarily driven by a fungal infections in the body, yeast infections in the body. Now, if mother before pregnancy, before delivery had that problem, that means she also had these infections. And during delivery process, she can catch these infections from the mother. The child can also get the same infections. It's not a genetic problem. You both can get better by eliminating the root cause. Child and a mother both can get better. You're on mute.
Okay.
I'm
Yeah,
happy.
let's open up for questions. Punita, you can unmute yourself and ask.
Hello, doctor. So I like after eating outside. So I developed some digestion issues, and I was already taking some medication from my homeopath for my digestion issues. But then what happened is like according to me, like while I was treating my child for the scalar part, and I feel that time I developed some loose motion, and which didn't stop after consuming normal homeopathy. So I took an antibiotic called O2, which according to me triggered some issues like in my ulnar nerve. And after taking some magnesium supplements and some tonics, those went away. But still, I feel in my right hand thumb, the issue remains. Like sometimes might be the issue remains like which according to me is an autoimmunity issue, might be like rheumatoid arthritis, but it is only on the right thumb. And the X-ray also, when I took an X-ray, it never shows me that there is an issue. The orthopedic said there's no issue at all, according to the X-ray report. And so I'm really puzzled that this is only that right now on the right thumb. So, and that issue of the loose motion was long back, but and after taking those magnesium supplements and everything, it became all normal. But only the right hand thumb issue is there. So, and it still doesn't reflect in the X-ray. So, but I'm already on the healthy diet, the gluten-free diet, and everything good I'm consuming. I'm taking care of my proteins and my monitoring my weight and everything. But still, I feel that why the issues is still there. I don't know why it's still there.
Right, Punita. So see, if inflammation is there, pain is there. Now, depending on the extent of the damage, X-ray might pick it up, might not pick it up. If
Okay.
it's a very early stage, now body is always trying to protect, right?
Mm-hmm.
So,
But 1 year has passed by. So do you think after 1 year or something, the X-ray should reveal that issue?
no, like I said, it also depends on the severity of the problem,
Okay.
not the length of the problem.
Okay.
If your body, you're doing a lot of right things, that means probably progression of the problem is not happening, but the base
Exactly.
of the problem is still persisting in the body.
Right. So
Maybe you caught up the infection, that infection is still persisting, it's not sort of gone from the system. Or antibiotic generally to be done with a lot of probiotics,
right.
but then that might not have been done. That has led to some
Exactly.
fungal infection overload, that has
Exactly.
led to some inflammation.
Don't
And
miss on that.
so probably something might still be pending, which should be done to relieve you out of the problem.
So what do you think like I should focus on, or what test, or what do you suggest?
I think as you're aware, Punita,
On the
we
bones,
can.
everything like on my knees, everything is perfectly okay. I have no other issue. Like normally with age, we develop something on the knees and the joints. So everything other than that is okay. Only on the thumb it remains.
Right. So you're doing a lot of right things, though. So that's a good part.
Courtesy your team and your like guidance. Since I'm
You're
following.
protecting yourself, but maybe organic acid test, which is Nutrifit,
Mm-hmm.
that will give some answers to the equation.
Sure. And anything on the diet or supplements, anything you would like to add or something, or after the test only?
I think, see, if you're taking basic supplementation, that means we have to go beyond the basic now.
Right.
Basics still helping, but not cutting through the problem. It's problem is still persisting.
Because I'm also taking an Ayurvedic kadha, which I just read it somewhere, and it helped me not increasing the issue though, but still I feel the issue still comes up, so it's not solved as yet.
Right. Right. Yes. Yes. So let's dig deeper.
Sure. So I need to connect with your team.
So, Punita, you can connect with Dr. Meera. She shared her number in the chat.
Sure. Noted.
Sai Aditya, you can please unmute yourself.
Hi, doc. So I was diagnosed in Jan with vasculitis, and I definitely I know that it's because of my lifestyle that I've been leading for the past few years, and an overload of stress on my body as well. And I have done the cryoglobulin test, and everything came out negative. Even the blood test for vasculitis came out negative, but they did a skin biopsy that came out positive. And I have been following through. I spoke to doctor. I forgot the name of the doctor from Functional Medical Clinic. I've done all the tests, I have tried to do the gut cleanse, but what happened was I was supposed to fly, but after 3 days I was on the strict uh, diet for like 3 days. Then on the fourth day I felt very weak. I mean, I was only eating vegetables cooked in ghee or coconut oil, and I was just sticking to it basically. I need my morning coffee. That was also triggering me, but I was pushing through it. On fourth or fifth day, it was very difficult for me to even. I found it very difficult, and I since had to travel. I just jump back to the normal diet. But to some extent, I would say 70%, 80%, I've been eating clean. I've been eating better than before. But my question is, since doctor advised me only to have protein shakes to eliminate a meal one by one and just go on proteins. So my doubt is protein not hard on the gut? And if I'll
Okay.
be taking protein shake thrice, uh, will it not, will it actually heal, or is it actually hard on
Okay.
the
So
kidneys or hard on the thing?
no, okay, so let's understand the purpose of this elemental diet. Okay. The protein that is used is coming with enzymes, so largely is very easy to digest. You want to put your digestive system into rest. At the same time, you want you to get enough nourishment that is required. So when you are on such a diet, you are also not feeding your infections. Now, without killing the infection, you are eliminating those infections, which are the reasons of leaky gut, thereby high inflammation affecting the vessels. So when you're on an elemental diet, you don't feed your infections. You start feeding enough nourishment to the gut lining so you can seal and cementing can be done. And no such thing that it will affect the kidneys. It's the quality of the product which will affect. If you choose a poor quality protein supplement, it can certainly affect. But if the right quality, actually, it should help the kidney function. And we have been doing with so many people with great outcomes. Yes. When you start doing it, now you have certain microbiome based on what you have been eating. Now, all of a sudden, when we change it, those microbiome that is pre-existing the system, which we want to kill anyway, doesn't get what it needs in the form of food. Then it start dying. When it start dying, the waste product of that can cause weakness temporarily. But that's a part of the process. If you go through it over a period of time, by the time you reach 2 weeks, 3 weeks, most people, they feel a lot of energy in the body because they are on the most cleanest kind of a diet where digestion is hardly, just your stomach does not need to get engaged largely, but you get clean fuel for your system.
And one more question, doc. Will my hemoglobin levels or anything drop during those uh, when I'm on the elimination diet?
No, no, no. It will improve only.
Okay,
See,
okay.
you are feeding a very healthy diet when you're doing an elimination diet, and the inflammation will come down. So you're not doing anything to bring down the hemoglobin levels. Okay,
Sure,
so
sure,
start with it again. You could not complete it earlier, but then start the semi-elemental diet again.
sure. Thank you.
Thank you. Ajay, please unmute yourself.
Hi, doctor. Hi.
Oh,
Am I audible?
yes, yeah, please go ahead.
Yeah. So my question was how is low libido like altered libido you know how is it related to the gut health and
Okay.
bacteria like all of these infections?
Right. So we have to understand the basic physiology of the body. Now, libido, in a way, it's a reproductive function. Now, if you have enough energy to survive, then you want to reproduce. But if your overall body energy has reduced, then libido is the first thing to reduce. Because first thing body want to survive, then it want to get into reproduction. Now, if your gut health is compromised, means whatever you are eating is not becoming part of you, but rather a lot of toxins are coming to your body goes into survival mode. Then your reproductive functions will take up go on a back burner and libido will come down. But if you improve yourself, your health, your gut health, your nutrition, your vitality, then you come basics will be taken care, and you can then, get into the reproductive things.
Right, right. Thank you, doctor. And doctor, one more doubt. Uh, I also observed that this issue gets better when I'm on a low carb diet, like the elemental diet, when I'm eating only vegetables and all that. And also after the course of nystatin, uh, it seemed to have got better. So how is that possible? Like,
So one of the major reason that we see, Ajay, is a load of yeast and fungal infections in the body. Now, if you take sugary things, you take carbs, you feed these infections. So kind of microbes we have, kind of byproducts we get. If you have unhealthy microbes, a lot of byproducts which are unhealthy goes to the blood, and they poison the mitochondria, and energy will come down. So when you don't take a lot of carbs or processed things, you don't feed these infections, then those toxins going to the system, poisoning is reduced, and you feel better. When you clean up with an statin, toxins are reduced and you feel energetic. So in temporal, it's like a car with the, a poor fuel going into the engine, the pickup will come down. But if you put the right fuel, again the pickup will get better.
right, right. Understood, doctor. Thank you. Thanks a lot.
Thank you. Dhara Vaidya?
Hello.
Yes.
Yeah. Hi, Dr. Ruhi. Hi, Ashwani sir.
Hello.
That was a wonderful session. Actually, I have few questions, but I am suffering from hypothyroid. So I would just like to first give you a sequence of events about myself so I can give you the questions better. I was diagnosed in 2008. So it was like more than 15 years back. So there was no functional nutrition, or like the endocrinologists were like leaving on, you have to take this levothyroxine, and I was started on that. But after doing this functional nutrition, now I am recollecting that I had episode of hepatitis E like 3-4 months before I was diagnosed this. And at that time, my TPO antibodies were high. I don't recollect it, but I was on levothyroxine. Now, after a few years, I developed a peripheral neuropathy. So my now biopsy has been done in Nimhans, Bangalore, and I think so. Dr. Aruna was there. Like it was also 10 years back. So they said they cannot do anything because it is not treatable, but you have a peripheral neuropathy. So since then, I have been taking thyroxine only. Since 2 years, I have done lot of diet and lifestyle changes, like taking all the essential nutrients and everything, omega, vitamin D, B12 and everything. Uh, uh, Once you mention in your slide, Ruhi ma'am, that leaky gut may have other symptoms also. So my question right now is, uh, I recently did my test and my TPO antibody is 30. My ultra sensitive TSH is 17. And my T4, free T4, I have done free T4, that is 1.25, and free T3 is 1.96. So free T4 shows in normal range, but free T3 is low. So now I am at that point, like whether I have autoimmune thyroiditis, I should treat my leaky gut. Do I have a leaky gut or not? Because I have, from that symptom list, apart from mood swings, I have not suffered from anything else or any gut issues. So two questions I have. How should I go about this? The report, does it show I have autoimmune thyroiditis right now? Or because I don't have any other symptom apart from my this diagnosis.
Right.
So, or should I
So,
treat leaky gut first?
so, yeah, I get the question. Now, first of all, you have to understand, if your T4 is normal, you are not hypothyroid. That you have to get.
Okay.
It's
Okay.
only your TSH is high, and
Yes.
TSH as such can go high in the state of inflammation, and you have certainly autoimmunity, right?
Yes.
Now, autoimmunity could be triggered by various factors. One of the factor could be leaky gut. Now, it could be there, it could not be there, but there are other factors also. Your history tells probably a viral infection could be a trigger behind autoimmune status in your system, which led to high autoantibodies of the thyroid plus neuropathy, for example.
Yes.
Okay, so autoimmunity is there. You are not hypothyroid. We should evaluate thoroughly to look at your infections, look at your toxicities, look at your liver function and all of that. And accordingly, over a period of time, we can fix it.
Sir, my HSCRP is 0.25. So it is like it's not showing any inflammation. I
See,
have
Dhara, you have to understand your antibodies are high, autoantibodies are high.
yes.
So, but you cannot stick to one marker. If one marker is okay,
Okay.
does not mean
Okay.
everything is okay, right?
Okay.
So you have to really understand that, this marker business, that is why we do so many markers. Sometimes one
Yes.
marker is negative, other marker is high.
Yes.
Sometimes there are 3, 4 autoantibodies that are typically tested for thyroid. Three
Okay.
might come normal, one might come positive. But if you don't do that fourth one, you only do the 3 ones, you might think everything is okay.
Yes. Yes.
If there's a problem, there has to be a reason behind it, whether we are able to test that or not.
Okay. So should I go? Is it like the leaky gut can be treated on its own, like with diet and lifestyle changes, or we have to take the L-glutamine and everything? So if I had leaky gut, so is it like it
Yeah,
is?
so again, I'm very categorically saying leaky gut is one of the reason.
Yes.
There could be other reasons also.
Okay.
You might have persisting viral infections in the body.
Okay.
It can get better by its own, but if it is not getting better after you doing the basics, that means you have to dig little more deeper.
Yes. Got it.
Hmm?
Okay. Okay. Sure. Thank you.
Okay, thank you. Kavita, please unmute and ask. Kavita, are you there? Okay, we'll move to Raj. Raj, you can unmute yourself.
Thank you, Dr. Agarwala. Uh, Good evening, Dr. Garg. My question is, I've been taking treatment with you for the last 1 month. I did my NutriFit test, blood test, everything. And what you talked about, the symptoms are matching 100%. And dysbiosis is there, bloating is there, pain is there. And what I don't understand is the diet that was prescribed to me was fiber rich. And I do have IBS-like symptoms. And, fiber-rich foods don't agree with me, especially millets and all that. I found it to be much more comfortable when I took rice, white rice, and I was told that starch is not good, so cut it down. And I'm taking some crazy amount of supplements as recommended. So I don't know if I'm reacting to those supplements or if I'm reacting to fiber. Or both. But fiber for sure is not good for me, based on my experience over the last 10 years. And the second part is I do understand why you prescribe proteins, but even taking proteins with digestive enzymes, the beta one that you prescribe, even that is not agreeing with me. I mean, I barely take a quarter tablespoon. Beyond that, I can't manage it. And I still feel bloated. I mean, in fact, my bloating is worse for the last 1 month before I started the treatment. So I'm not sure whether it's a supplement issue or if it's my diet issue, but I'm sticking to whatever you have said. And in between, I took semi-elemental diet for 10 days. That didn't help either because my bloating was exactly the same. That's how I found out it's not the food that's going in. And um, um, the bloating hasn't changed since I started. I don't expect it to change immediately, but still, none of these supplements, I'm not sure if they're taking effect or if I'm doing something in terms of diet that's wrong.
So bloating means whatever you're eating is getting fermented, or the microbes are so many, the bad ones which are making too much gas, which is causing the bloatiness. Now, typically when we want to, it's not that if today you're not able to digest fiber, you will not be able to digest fiber in the future also. Yes, if you're missing on those microbes in the beginning, slowly, gradually, we can redevelop as we clean out the gut and redevelop those microbes and change the balance of the microbiota, then you will be able to. So, but if it is becoming a problem, millets are becoming a problem, then you can switch to, let's say, uh, brown rice, for example, quinoa, for example, okay, or jawari, for example. But white rice is not a good option. You might be able to easily take it, but then white rice will feed the infection, which is a problem in the first place.
Sorry to interrupt, doctor, because I have IBS-like symptoms. I need to factor in that whatever I take is in the low FODMAP list. And brown rice, again, gives me this reaction. I feel
So-
constipated pretty much.
See, removing fiber will give you symptom free for some time, but removing fiber will not resolve the problem. Now, what is the problem here? We have certain infectious microbes which can ferment the fiber. That is why we go low FOD map. But when we clean out these infections, we reinstall healthy, you will be able to handle the fiber also. And you should be able to handle the fiber also. But then till we achieve that, you can keep it low. Whatever fibrous things, you can keep it low, no problem. But then we also has to do the cleanup very, very deeply. Okay, it might take time depending on the sort of how long it is there with you. So cleanup can take, but typically a lot of people feel much better on elemental diet. If even on the elemental diet, because protein is another thing that you cannot digest, go slow, but slowly, gradually, you will be able to develop the ability to digest proteins, also fibers.
Just one quick follow-up. Is the Vita one that protein with digestive enzyme, is that hydrolyzed, or would you recommend a different protein?
It is not hydrolyzed, but it comes with a lot of enzymes. It's very, very easy for most of the people that we have worked with. In fact, we have been using a hydrolyzed protein, which is wave hydrolyzed, and this beta 1. People have found beta 1 protein is much easier for them. But if still it is, you're finding it difficult, probably we just need to allow it more time for the system to heal.
Is there an SOS? I'm happy to take it, but is there an SOS or something like that that could help me? Because the symptoms are really worse.
Okay,
Meaning
so
the
let me,
heaviness and the pain.
right. So Raj, what I'll do is I'll speak to the concerned doctor, then we'll come up with a strategy.
Thank you, doctor. Thank you so much.
Uh, Dr. Garg,
Yes, sir.
good evening. Thank you so much for this insightful session. My wife has been suffering from acute pain because of
RA.
arthritis, RA. After the birth of my son, our life was normal. He's 17 years now. It's been 17 years now. She's been struggling a lot of this problem. And last 3 years, she went on a millets diet actually. So what happened? Somehow she controlled those inflammation. Her, knees, especially knees, used to swell like a small watermelon, sort of thing. And what happened? She went on a millet diets. So basically, gluten-free, protein-free. 70-80% got cured, right? But
Just to interrupt there, I think I spoke to your wife, and the millet diet was Ambli, right? She was taking a lot of Ambli.
Amli.
Yeah, fermented millets, basically.
Yeah, ma'am. Yeah. Dr. V.
For 6-7 months.
For a couple of months, but before that, she was taking other millets, right? And what happened? The collateral implication of that was that she lost her weight. She was never have a good sort of high weight. 50. She used to maintain about 50 and went down to 39, 40. So what happened? I guess that because of that immunity went low, right? And she started developing other sort of infections, right? So that is one problem. But last couple of days been terrible for her. So terrible that she just keeps rolling on the bed. There is no cure that triggered and one of the foot has got overswelled. She can't put her foot on the floor. And on top of that, yesterday night, her ankle, like earlier used to happen, also got swelled, inflamed, and a lot of pain actually. And she earlier, when it used to happen, extreme pain, she used to take Nicoxia, that painkiller. But what happened last couple of days, 2-3 months, since 2-3 months, it is reacting actually. So the poor lady does not have any other recourse now. She can't go even for a momentary pain sort of relief.
Right.
So just wanted to know, how do you really reckon with these issues? What is your
one of the typical reason that we could explain is a leaky gut behind high inflammation.
Okay.
Leaky gut, one of the reason of leaky gut, of course, the food could be one problem, but infections is another major problem.
Okay.
A lot of time, Even we change the food, but we don't clean up these infections. It's causing the breaking the seals of the. Then until we clean out these infections, then this inflammation can trigger out. So, considering the severity now, slowly, gradually, we have to work with it. It might take some more time to fix it. Now, weight loss, not necessarily because of millets. What you eat, you have to digest. Then it only becomes part of you. But then again, we are not only saying that only millet can be game changer. Millet is one part of the game, but we have to do so many other things to work with such an autoimmune problem. These are not easy problems, but if we put enough effort, slowly, gradually, we work with that, I'm sure she will get better.
So, no, but the other thing is that she's saying she's not taking any nutrition, doctor. Supplements, etc.
We have to test, madam. We have to test you, find out what is your system requires. Accordingly, we can supplement. But again, considering your reactivities, probably we have to go very slow.
So, Dr. Garg, how do you think this can be cured?
Certainly, she should become healthy.
Okay. So, how do we really approach you? Because we, Dr. Ruhi, I think I could not speak to you yesterday. The only thing is that how do we really approach you? I mean, we would like to show you her condition before we start the medicine or whatever you suggest, the format. One person on online or whatever you suggest, a consultation followed by a treatment.
Oh, you're not muted, Ruhi.
So I pretty much explained, I think, and she's been in touch with our team as well, right? For us to understand what's going on in the body is with the help of the biomarkers and the sign and symptoms. Okay. Seeing the swelling is not going to help me make a treatment plan.
Sorry?
Seeing the swelling, where the swelling is, it's not really going to help me make a treatment plan, right? What will help is what is going on inside the body, what the biomarkers are, what her whole body sign and symptoms are. That is the information we need to come up with a treatment plan.
Okay, you don't think so? There's a need actually. Now, Dr. Ruhi, to be honest with you, it's more of a psychological issue. To be very honest, doctor, I was only wondering from that perspective. Even you charge some fee for, especially that's okay.
Not a matter of charge. See, I think we have set up our processes, and it's not a matter of charge every time.
Right. So you don't deal with the patient directly. Do you mean to say?
We deal with directly, sir, but we don't deal physically.
Okay.
See, again, these are chronic problems. Okay, we don't want unnecessary travel. Something we can solve while you are home in a very, very nice way. So let's do what we think is the best. Of course,
I was only wondering if you could take I'm sorry that I'm little being insistent on that. I'm really sorry for that. If 5-6 minutes video call is also okay with you, are okay with that?
Sure. We'll discuss. Okay. We'll discuss.
Sure. So we'll approach through your team. How do we? I mean,
I think you're in touch with Dr. Meera, right? So yeah.
Yeah, sure.
Without medication, it will be
all right.
No, but the last only follow-up question is that without medicine, it can be cured, or one has to take some medicine, Dr. Ruhi?
See, you have to understand triggers has to be removed. Trigger could be infection. Infection might need medicine, might need herb, might need something else.
I'm not taking allopathic medicine.
She's not taking allopathic medicine
for the last 10 years.
10 years, last 10 years.
That's no. See, I'm saying we don't want you to get dependent on allopathic medicine for pain. Now, if you are under tremendous pain at this point of time, it is a good idea to relieve yourself from the pain so that mentally you are prepared to heal. If you are stressed out, healing becomes much tougher.
Right.
But while you are doing any medication, we fix the root cause, so need of the drug will come down.
I appreciate. So, thank you so much. We'll approach through Dr. Meera or whatever we suggest. Yeah, we'll do that.
Okay, we'll move a bit quickly. We are running out of time. Ravi Kiran, please unmute yourself.
Good evening, ma'am. Good evening, sir. Sir, I am pulmonary arterial hypertension patient, as a part of which we need to undergo heart and lung transplantation in the future. for which like we have to use heavy autoimmune suppressants. So my question is, instead of using someone's heart and lungs, what I do is like I store the pre-embryonic stem cells of my offspring, and then I develop my own heart and lungs. Can this be a condition where I need not use any autoimmune suppressants, where I should not be affected with this autoimmune disease?
So, Ravikiran, if it is your pulmonary hypertension is due to an autoimmune process,
Hmm.
we should be able to handle that. But
Okay.
if some other reason is there, then
Mhm.
we are no experts in that area. Okay, now
Okay.
next question that you posed on the stem cells and developing
Yes, sir.
heart,
Yeah,
we
yeah.
have
Okay, so fine.
far
Thank
away
you, sir.
from that.
Yes.
At least autoimmunity perspective, we can certainly help you with.
Sir, pardon, sir. Autoimmunity perspective.
If your pulmonary hypertension is due to an
Okay, okay.
autoimmune process, we can help you.
Fine, sir. I got it. Thank you, sir.
Alka, please unmute
Yeah,
yourself.
yeah. Good evening, doctors. First of all, kudos for your wonderful work. I've been taking functional medicine treatment for myself and as well as for my daughter who has autism. So I've been taking it for about 5 months now. So what has happened is that I've been a patient of scleroderma, and in between I also in my right ankle I developed bursitis. So it was a non-healing ulcer for a long time. So uh, very at a very later stage I got a x-ray done where it showed that it had reached the bone also. But now I'm regularly visiting a surgeon who does a lot of dressing every day. So subsequent to that, it has improved. Thankfully, it is healing now. But in the process, what has happened is that the doctors have given me very high medication. For example, Mycocept, and again, like one more patient we talked about, my weight also drastically came down to 38 from near about 50. So I was been because of this bursitis thing, they put me on very heavy medication. First, Mycocept. Initially, I was recommended Mycocept for just 500, but eventually I took for 2000 for 2 months. Then they gave me Endolac kit again at a very high dose, 5 in the morning and 20 in the night. And thereafter, there were these bout of inflammation. So I was put on antibiotics very regularly. Because of all this, I think so, I did not get the kind of effect which I would have got following the functional medicine. So still now what has happened is, although the bursitis is healing, but I am confronted with one problem or the other on a daily basis. Sometimes I get this is lung infection. Sometimes my stomach is often not up to the mark, and sometimes it really get flared up uh, because of these medications, I suppose. So in totality, like I have still not got the optimal gut health. So my worry is that I mean I can't stop all the other things which are happening. So one way or the another, whether I like or not, I have to resort to these other medications. So in that way, if this keeps triggering on, then how will the gut health improve? That is my first question. And the second question is, even when the gut health uh, improves, uh, suppose I reach a optimal gut health, how will it convert into actually healing my autoimmune disorder, which is scleroderma?
So one of the reason of scleroderma in itself is again a yeast fungal overgrowth. Okay. Unfortunately, a lot of antibiotic will grow more of yeast in the body, fungus in the body. Okay, so at least a very, very high dose of probiotics along with those antibiotics, if you keep taking, then the damage can be reduced. There's no way we can undo the damage fully, at least till it is going on for the purpose. Now, one other way to look at it is probably instead of only doing pharmaceutical antibiotics, we can switch to a little bit more aggressive herbal ways of doing it. Probably that might support the system. But then
Sorry, I didn't get this.
I
The
have been
herbal
looking
in
at your pictures that you have been
herbal what, sir?
herbal, for example, oregano oil, for example, berberine. Now these are herbal formulations which are antimicrobial. Still, they are
Okay.
not so bad for the microbiome.
Okay.
Plus, a very high dose of enzymes can be very, very beneficial. Uh, so I have been, I'm aware about your case and keep looking at your images that you have been sending to Dr. Tandon.
Yes,
So
yes.
high dose of enzymes can also help to maintain a blood flow to that part of the where ulceration has happened, so that healing can happen faster. Ultimately, blood flow to any ulceration part is reduced. That is where healing becomes much more tougher. A high dose of enzymes can also be useful. So I will again, we have to individually discuss this. It's a quite a complex thing, but I will talk to Dr. Tandon about it.
Okay. Thank you.
Thank you. Mahesh, can you please unmute yourself?
Hello, ma'am. Hello, sir. Good evening.
Evening.
Can you hear me?
Yes, yeah, please go ahead.
Yeah. Actually, I did some blood test recently, and I found that this lead heavy metal is exist in my blood report, which is very very high than normal limit. So, is it related to gut health or something else? And even I have problem of bloating as well.
Right. So you might see it might have a lot of Ayurvedic drugs we have seen having high lead. So you can check if you have taken any Ayurvedic drugs in the recent times, or the quality of
Uh,
water, quality of food, and all of that can also affect. No, lead
okay.
high in the blood will compromise immune system. Thereby, infections can grow. Thereby, gut can get compromised. But Dr. I take a break.
Yeah, so Mahesh, heavy metals in the body, they disrupt the immune system basically, and they also promote the growth of unwanted pathogens. Okay, so what we also often see that when there are high heavy metals in the blood, that person also has a lot of GI symptoms, gastro symptoms, and you just mentioned about bloating, right? And that's so definitely there is a correlation between your high heavy metals and your symptoms. So heavy metals.
Right. Even the problem with indigestion, and sometimes it is like not eating so much, but still stomach is full.
Yes, yeah. So that's common. And so basically the approach will be to kind of address these heavy metals, remove them from the body, and support the gut health. Support the gut health with enough enzymes, and a lot of your symptoms are also because of, as I said, the growth of unwanted pathogens. So you will have to address these infections also. And as you do that, you will see your symptoms getting better.
Okay. And ma'am, I mean, even recently, while doing the annual medical checkup, I found that my BP is like on boundary of hypertension.
Yes. Okay.
So the doctor said that if I don't take, I mean, he suggested a lot of to do the exercise and vegetables and fruits. So this can also be addressed in this
Yes. So
program.
understand, hypertension is basically the blood vessels have become stiffer, right? It's offering more resistance. Now, why the blood vessels have become stiffer is because of the inflammation in the body, which is also affecting the arteries. Okay, so that's the beauty of functional medicine, that when we work, on any individual, it's a whole body approach. We don't just treat one disease, one problem in that body. It's the entire body which will get healed.
Okay, okay, ma'am. Fine. Got it. Thank you very much.
Thank you. Neeraj, please go next.
Hi, doctor. Doctor, I've been taking treatment of Dr. Ashwani and you for my 12-year-old kid, Divyansh, under the guidance of Dr. Apurva. We are really happy. We have seen good improvement. Primary problem was basically, he used to have, he cannot digest a lot of food and, he'll have diarrhea. Not really diarrhea, but mostly he'll pass motion multiple times if we eat gluten or something like that, right? So one of the thing which we've been keep talking to Dr. Apurva, and we learned about leaky gut, right? So one thing which came recently, we were consulting an airway dentist, and she apparently told that a lot of these things agree that there is a leaky gut problem, but a lot of these things also happen due to my son is a mouth breather. And a lot of these things also happen if if the breathing is not proper, apparently, right? Now we are trying to fix that problem, but again, he is a 12-year-old kid. He goes to school, he'll share a tiffin, he'll have gluten, and and then after a week we'll see that he's again getting inflamed. So just wanted to understand, are these all connected in some way or the other? And, yeah, we are really seeing good improvement with FMC, but then, after some time, we again fall back to the same situation, right? So what is your opinion about that?
See, until good gut healing has happened, the inflammatory food will cause a problem. So if you know that the child will eat from other tiffin, he will have
Yeah.
gluten, then you will have to kind of make it maybe a practice for a few days. You give him digestive enzyme when you know that he has taken the restricted food, right? That way you are at least kind of while the body is healing, while you're doing so many things, right? Then these instances will not cause unnecessary problem in the process of healing, right? So that you can definitely do. And second, mouth breathing, of course, that gives easy access to the body to certain unwanted pathogens, etc., right? So are you doing anything to help him kind of do better with that?
Yeah, we are taking treatment for that. He has a high palate. He actually had adenoids and tonsils, and then we got them removed. And then he has a high palate, so we are using expanders to expand that. But again, we are also expanding the lower jaw. We are doing all that treatment. Recently, we had done the frenectomy, the tongue tie release for him. After that, we had seen again some improvement. Again, when the inflammation happens, right, we can clearly see that he's becoming a bit lethargic. His muscle tone will become very loose.
Right.
Yeah. Other thing I wanted to ask, is it only the joints which get impacted due to inflammation, or the internal organs like lungs, intestine, even those get inflamed?
Anything can get inflamed.
Okay.
Immunity can affect your joints. See, many of the things you can see, right? When your joints are affected, when your skin is impacted, right? You can see all those things. But for example, if the vessels are affected, you don't see. If the lungs are infected, you don't see until you have a lot of symptoms, right? If your liver may be impacted. So a lot of things are very obvious, while various things can be more internal.
Yeah, because we had seen that whenever he's getting inflammation, right? His sleep really get disturbed, and then he'll all have that sleep apnea episodes and all the, the related, like for an example, he will have a secondary pH due to that. His pH goes up and down, purely depends on his sleep, right? So, fine. I was able to find a lot of answers with FMC, so I'm really thankful for that. Yeah.
All right. Monica, please ask your question. I've seen your question in the chat.
Hello, doctor.
Yes.
Yeah, doctor, my mom is diagnosed with Jogren and RA, and I have also diagnosed with SLE APLA, and I had TVT. Due to this, I have CTPH. So my question is that in our family we have this genetic disorder like autoimmune conditions. My mom had this, and I also passing this genes, and so we also diagnosed with oculocutaneous albinisms, and we have done certain genetic tests, and the doctors told me that was due to the DNA modifications, I am having this DVT. So my question is that my platelets count is very low, but instead of having this low platelet counts, I am getting the blood clots very faster. Like I am on high dose of blood thinners, it is 8 mg and 9 mg alternatively warfarin. But instead of having 8 and 9 mg warfarin, my INR level is around 2 point, or is 1.8 or around 2. So what is the reason of that? Why the platelet count is low, and again there is a blood clots?
See, now you're diagnosed with one condition, right? But you have to understand autoimmunity can show up in various ways, right? So on one side, you have an antiphospholipid syndrome, right? Now, definitely it can affect your platelet count also, right? You don't have to have a formal diagnosis, right? Which is labeling a certain form of thrombocytopenia to give you a diagnosis. But then when the inflammation is high in the body, it can affect various parts of the body. It can affect various processes. Okay, so it's possible that it's affecting your platelet count also. Okay, and now your concern that your mother also has it and you also have it, and probably you may also think that, you know, the others, the future generations may also have it, right?
No, my question is what is the reason of this APLA? Like, is it only the autoimmune conditions, this DVT and APLA? Because I am a healthy person, and 7 years ago I suddenly diagnosed with all these things, and now I have severe pH. Due to this, my heart and lungs both are very worsened. I'm on 24-hour oxygen support. So these things.
So, Monica, now, as I said in the beginning when I was doing the session, right? Most of us, if you look back, someone who's diagnosed with an autoimmune condition, they were pretty healthy, 30, 35 years, absolutely, you know, a healthy life. And then, you know, over a period of time, the diagnosis of an autoimmune condition has come, right? So definitely during the course of life, something has contributed to it. Okay. You may or may not have a genetic predisposition. Okay. But what kind of environment you're giving to your body, that plays a big, big role. In some cases, a genetic predisposition may be high. In some cases, there may not be genetic predisposition at all. But what we are giving to the, what environment we are giving to the body plays a very important role. And APLA has an autoimmune connection.
Okay. And my one more question is that what is the role of HCQS and Azuran on APLA?
I think we already covered that earlier. Dr. Garg had answered that. So they are immune modulators, right? So I mean, they are very commonly prescribed immune modulators in autoimmune conditions.
Okay, whenever I have taken this SCQS, my doctor also prescribed this SCQS and APLA, this Azuran. But whenever I try to take this medicines, I don't know what's wrong with my body, but I'm not able to take it. Whenever I've taken SCQS or Azurans, certain symptoms and signs are there, so I have to stop this. I'm on steroids, Bisolone.
So, Monica, it can be possible that certain drugs will not suit someone. So, and if it's not suiting you, it's not a good idea to continue to take it. And if you choose to be on allopathic medication, you should definitely discuss this with your treating doctor to see what else can be prescribed to you.
Okay, thank you, doctor.
Okay, thank you. All right. I don't know what's the full name of SS. I can see a questions. Okay, I will read out the question in case you're not able to unmute. Can you let me know about aluminium? My body has a high levels of aluminium. So yes, the first thing is you have to remove aluminium vessels. So all aluminium vessels, all what is this? Non, what is it called? I'm just forgetting the name. All those coated vessels have to be out of your kitchen. And of course, you have to watch for, the source of your vegetables, fruits, because they can have pesticides, which can be a source of aluminum. Yes, thanks, Reshma. The non-stick pans have to be out of the kitchen. And the household cleaners, often they have certain, source of heavy metals. So aluminum can be one of them. So do check that and remove it from your, we kind of swap it with much more organic and clean label products. And yes, they can be, heavy metals can be a reason of brain fog. Again, they will cause disruption of the immune system. They will cause the growth of unwanted pathogens like candida overgrowth, which again can contribute to brain fog. So it's a very common connection: heavy metals, brain fog, fatigue. So that's why whenever we work with any case, we check for heavy metals. All right, so I'll take this last question. Is sunlight cause flare of lupus? So now here, most patients diagnosed with lupus, they have been told that you do not go out in the sun, right? Now, lupus is fungus-driven autoimmune condition. And someone having lupus, they definitely have a fungal infection. So one thing is, fungal infections can flare up with sunlight exposure, and that's why you see a flare in your lupus symptoms. And the second is, your body needs to develop a tolerance for sunlight exposure. So if you directly go in sun, right? So you have to slowly build up your callus for sun. Go in the early morning sun. Start with 5 minutes. 10 minutes. As you see your body tolerating that, that's when you can start going out in the afternoon sun, evening sun. So build a callus for the sunlight. That's when you will not, you'll see a decrease in the flare. Sunlight is very important, right? So you cannot just skip sunlight. Rather, you start exposing in small amounts. All right, so it's almost 9. I'll have to end here. Thank you, all of you. And I hope we were able to clear some concepts for all of you. And Dr. Garg had to leave. He was not able to speak a lot because of his throat. And but thank you for joining in. Thank you, Dr. Meera and Anwar, for your efforts.
Thank you for the excellent session.
Thank you.
Thank you, ma'am.
Yeah. Thank you, all of you, and have a great evening. Thank you.